right, thank you everyone for joining us for our webinar today. My name's Laura Katawaki, and I'm a Research and Knowledge Mobilization Specialist with United Way BC, and the pronouns I use are she and her. Today, I'm really happy to be hosting this webinar on technologies to support older adults to live well and age in place. Before we begin the webinar, I'd like to do a land acknowledgement. So United Way BC acknowledges the homelands of the Indigenous peoples on this place we now call Canada and honors the many territorial keepers of the lands on which we work. I personally today am working from home, so I'm calling in from the traditional, ancestral, and unceded territories of the Coquitlam First Nation. And in Hunkaminam, Coquitlam means red fish upriver, which is a recognition of the fact that there used to be thousands of salmon that would come up the Coquitlam watershed, and that was before the damming of the Coquitlam River in 1904. After that, the salmon population actually was almost close to extinction, but the Coquitlam First Nation, in partnership with other conservation partners, has been working really hard to revitalize the salmon population. And so a recent success has actually been that in the last few weeks, there's been a few salmon that have come back up to the Coquitlam watershed, and they did a DNA test, and they are the Coquitlam sockeye salmon. So they were very pleased about that news. So that's something I think that's a small but significant achievement. I did also want to acknowledge that for our talk today, of course, focusing on technology and remote monitoring services and technologies, we do know that not all communities in Canada enjoy the same levels of digital connectivity and infrastructure as we do in urban areas. And so in rural, remote, and Indigenous communities, which often can, I think, benefit sometimes the most from these types of technologies, sometimes there might be a gap. And in a recent report that was done by the Assembly of First Nations, they actually found that 61% of the First Nation communities that they surveyed didn't have adequate access to high-speed internet. And so I think that's just a reminder that there's still work to be done on the broader policy level in order to ensure that everyone has access to high-speed internet. And hopefully then they'll also be able to enjoy the technologies that can support them to age in place. I have a few housekeeping notes now. So during the webinar, everyone is going to be muted. Feel free, if you'd like though, to introduce yourself in the chat box. There's an automatic closed captioning tool at the bottom of your toolbar that should say CC. And if you want to turn this on, you can turn on the closed captioning if that would be useful for you. There is going to be a question period at the end, so please feel free to use the Q&A box at any time though, if you'd like to put in a question, and then we'll answer them at the end of the presentation. And I also want to note that the webinar is being recorded, and we'll be posting it on Healthy Aging Core and sharing our slides as well. So without further ado then, I will introduce our presenter. So today our presenter is Emma Rossnagle, who is the Center for Technology Adoption for Aging in the North, or CTAN's, Research Manager at the University of Northern British Columbia. She holds a master's degree in public health from the School of Population and Public Health at UBC, and is currently a PhD student studying health sciences at the University of Northern British Columbia. With over 10 years of experience in community-based and qualitative research methods, Emma's research interests include health and well-being of equity-deserving populations and the intersections of aging in place and technologies and how they can support this. And so I'd like to welcome Emma and turn the floor over to her for her presentation.
Thanks so much, Laura. I'm just going to share my slides here. All good? Perfect. Wonderful. So hello, everyone, today. My name is Emma Rossnagle, and I am coming from the unceded territories of the Lheidli T'enneh, a beautiful, beautiful region in the north, and I am very privileged to be able to live here and work here. So today we're going to talk about examining the impact of remote monitoring to support older adults to age in place in BC. And as Laura said, if you have any questions, I have another Laura here who's going to be looking at the chat and can make sure to answer those. And then any in Q&A we'll have time for at the end. So what is age technology? Age tech is a subset of health technology industry that supports healthy aging to improve the quality of life for older adults, as well as their caregivers and the health care professionals that support them. And a common misconception is that older adults don't use technology. In reality, older adults have been adopting technology at increasingly growing rates in the recent years. And they're doing it more than ever before. Internet, smartphones, tablets, wearables, and even smart TVs and speakers are being used by a lot of older adults. And some stats have shown that really it has increased significantly since the COVID-19 pandemic. So we have 88% of Canadians aged 65 or older using internet daily. 65 plus are streaming. Around 65% of older adults use a smartphone. Most use it daily. And 23% of older Canadians use video calling on their smartphones. Additionally, we have many aged 65 plus Canadians, around 66%, using YouTube, WhatsApp, Instagram, Facebook, and many use it for health, wellness, and/or independence. And as Laura had mentioned, we do know that there are barriers in rural and remote communities. We know Canada's population is aging, even more so actually in northern BC, in the Northern Health region. And the availability and accessibility of health services is just not keeping up. And at CTAN, our thought is technology will be vital to support aging. Now, some of the barriers that Laura did mention is the infrastructure for Wi-Fi, for instance, or cell service. And some of the technologies I will be talking about today actually do work in lower Wi-Fi and on a landline-based options. So we do have some ways to mitigate that, but of course, we always do want to advocate for more infrastructure. And we hope that while the population is aging, this does precipitate more infrastructure for Wi-Fi and cell service going out through northern as well as rural and remote areas for BC and across Canada. So mentioned CTAN a couple times, and we call it CTAN because the Center for Technology Adoption for Aging in the North is a bit of a mouthful, but we're a national innovation hub, and we support aging in northern and rural communities by making technologies more available to older adults, caregivers, and the healthcare systems that support them. So what does that actually mean? Well, we think that there is a gap. There is a gap between the people that need technology and potentially the businesses and organizations that can supply them, as well as there's sometimes a gap between the technology available and the needs for those that would be using them. So to address this challenge, CTAN was built on a partnership approach. And this is with health authorities, Northern Health Authority, as well as AgeWell. CTAN is a collaborating center for innovation and technology development and implementation, to support older adults in our communities. We co-develop projects and establish partnerships with technology companies to meet the needs of our northern and rural individuals. And our first thing that we generally do is try to understand the challenges, needs, and operations of the many communities in our region. This means that we need to talk to people. We need to talk to our communities, our healthcare providers, our older adults, our care partners, and we work to co-develop projects with the companies, the age tech companies, as well as the communities, so that we can ensure that we are meeting those needs and bridging the technology gap. One of the terms that you'll hear a lot is aging in place these days. And aging in place is important. It means having the health and social supports and services that you need to live safely and independently where you want, whether that be in your home and community, or in a long-term care or in assisted living for as long as you wish and are able. So by 2052, 1 in 4 Canadians will be 65 plus, living longer and healthier than previous generations. At the same time, also, when we live longer, more morbidities show up. So we do need those services that may not be available in our homes. 95% of Canadian adults, 45 plus, agree that aging in place supports independence, comfort, and dignity. 92% prefer in-home care to long-term care. And 96% of adults, 65 plus, would do everything they could to avoid entering long-term care. This tells us that people want to age in place, want to age at home, want to age in their community. So how can we support that? Going into remote monitoring systems. This is kind of the breadth of what we're doing right now in our work with CTAN. So remote monitoring systems. If you haven't heard of what they are, we'll talk a little bit about it. But not sure if you knew, but the history of smart home technologies isn't actually as new as people might think. Efforts at smart lighting and homes from Thomas Edison, that's on the left panel there, that was in 1910. The Rural Electricity Administration, 1933, that's in the middle there. And then General Electric and Westinghouse was 1956 in the right panel. So smart home technologies have a much longer history. The idea started that homes could be smarter and more comfortable and more convenient, and that can be traced back to even the 1890s. This was when more affluent people used the introduction of electricity to create homes with greater degrees of automation and levels of luxury, relaxation, and indulgence. Thomas Edison himself patented automated color lighting for homes as early as 1910, used later that year to promote public advertising. The Rural Electrification Administration in the United States actively promoted during the 1930s an array of modern electric appliances to go hand in hand with efforts to electrify rural farms. And then General Electric and Westinghouse launched the Live Better Electrically campaign in 1956. And that awarded homes a gold medallion if they converted all their appliances to electricity. So we've actually had a very long history of wanting to electrify and smart our homes. So what are remote monitoring systems in a more current way? Remote monitoring systems use technology to help track health and safety from a distance, so remotely, allowing older adults to stay independent for longer while getting the support they need. The systems that can be implemented through health platforms, wearable technologies, motion sensor systems, and emergency notification systems. The sensor-based remote monitoring is what we'll mostly talk about today, and it's becoming more popular for its ability to simultaneously track health, activity, and risk potentials in real time. It does promote independence and facilitates early detection of health or safety issues like falls. So what can they really do? Well, one of the big ones is reduce wait times, enhance coordination, and promote more equitable, high quality care for older adults. Remote monitoring systems can deliver home-based, data-driven care through telecommunication and AI, which allows older adults to connect to caregivers and providers they might not regularly be able to. Also, it allows us to empower older adults to actively manage their own health, support their independence, their safety, and the ability to live where they'd like. So Hargraves and Wilson in 2017 looked at how smart home can collect and analyze data in a domestic environment, relay that information to end users such as service providers, care partners, or older adults themselves, and enhance the potential for managing different types of systems within the home. So main categories that we have, for remote monitoring systems are fall detection, fall risk. So smart homes and remote monitoring systems can actively, in real time, do gait analysis on people living there to look at their fall risk. Agitation prediction, wandering detection. One of those things that we know is humans like to wander. It's a really natural activity. However, when we have someone who might be in cognitive decline, wandering can also pose a safety risk. So wandering detection is a big part of remote monitoring systems. Wayfinding and queuing, smart voice and two-way voice. So you can wave your hand for some and you can talk to the user on the other side. Health monitoring, of course, like vital signs, social engagement, and lighting, safety, and security. So this is kind of the simplest of smart home / remote monitoring technologies. Contact sensors. They're very easy to install. They can be connected to interior doors. As you can see on the left there, that is the sensor closed and then open. When it opens, an alert will go off to whatever device that you've connected it to. For a caregiver of a person with cognitive challenge, these sensors can be linked to an alarm during the night to wake them should their loved one try to unlock the door and wander. If a caregiver was away at the store, for instance, they also might be notified if their loved one has left their bedroom or gone outside. This information can be quite helpful and provide a lot of peace of mind. Sensors can also be placed on refrigerators, for instance, and can be quite helpful to remind that the door has either been left open or maybe that someone like your loved one hasn't opened the fridge for food in a few days. This is a really interesting one called smart turns. This is for safer cooking. Maybe the particular scenario that you might be familiar with is for leaving the stove on. I know I've left the stove on a couple times. And this is a really cool intervention where there are actual smart turns that replace the knobs on the stove. And this is where this technology can come in handy. We have a display in our lab, as you can see on the left, and it shows the combination of, it's combination of occupancy sensors and knobs that couple with notifications. So as you can see here, the demo stove, you can see it's been on for one has been on for 2 minutes, one has been on for 1 minute, and then you can see the usage. If someone forgets to turn it off, a notification can be sent to a cell phone of a care partner, and it will let them know that the burner has been kept on, and they can turn it off through those alerts. So that's a really new and interesting one that we have in our lab. So to a large research project that we are doing across the province, it involves a variety of remote monitoring technologies, and we are currently recruiting. So this is actually designed in collaboration with the Ministry of Health, the University of Northern British Columbia, CTAN, Interior Health, United Way, and many others. So what is this study? A variety of technologies like remote monitoring systems can support aging in place, as I said, and improve health-related quality of life. The thing is that despite the wide availability of this type of technology, there is actually very limited implementation across the province, with only one health authority providing and supplying any type of remote monitoring technology to residents, clients, and patients. So recognizing the prospective benefits afforded by this type of technology, and through the support from the Center for Technology Adoption for Aging in BC, and in partnership with the Ministry of Health, we are delivering a project for 1 year to look at how remote monitoring systems in homes of older adults may improve safety to age in place, delay need for long-term care, and enhance support and well-being for caregivers. So what are the remote monitoring system options within this study? We have 4 that can be chosen from. One is called Altumview Centenaire. Then we have CareLink Advantage, TalkTech VeriCare, and MetaSweetie Care Predict. We will be collecting information around quality of life pre, during, post implementation of the chosen system. So I'm going to go through each system, and then I will do a brief, detailed look at what the study looks like for participants. So Altum View Centenaire is a non-wearable, so it has nothing that is on the body, remote monitoring system that uses privacy-preserving camera sensors to detect a care recipient's movement and falls, recognize care recipient activity, and allow for voice calls between a care recipient and care partner. So I'm just going to go back one slide, and if you look on the left here, you can see a woman has fallen in that top photo, and then below, it has actually turned that image locally into a stick figure. And that is what they look at as privacy preserving. So some of the interesting things with Altum View Centenaire is that you can have restricted areas. For instance, this will be what can help with wandering or areas that you might not want someone to enter. This could be useful in a long-term care setting or a more public setting, as well as an individual's home. It also does fall risk and fall detection. You can also, if something is to happen, wave, and the camera will pick it up and call your care partner or whoever you have identified as the end user on the dashboard. Another piece for Altum View Centenaire is that it can do fall risk assessments, and it can also do playbacks of the fall, 30-second non-save playbacks. So that helps. It also recognizes faces. So if mom, for instance, is at home and you've gone out shopping and someone that she doesn't recognize comes into the home, it will do the face recognition and can alert you that someone, a stranger, is in the house, or someone has stayed longer than they should, or for instance, someone hasn't arrived when they're supposed to. Lots of different uses. Then we have CareLink Advantage. This is a combination of wearable and non-wearable remote monitoring technologies. All of these, I must say, are very customizable. So within this project, in this study, which is of no cost to participants, they would be talking with our Laura here, research associate, who goes through all of the options and allows you to customize as you'd like. So CareLink Advantage, for instance, uses sensors to look at motion, door, bed, and other areas of activity. This one, again, can be customized to best meet the needs of the care recipient or care partner. And CareLink Advantage also can work on low Wi-Fi or landline. Not all of the pieces, but some of the pieces can. So it can be adapted and it is flexible for a variety of homes and needs. It also has a medication sensor as well. You can kind of see it there in the right corner of the photo, and it actually takes a photo to ensure that someone has taken their medication on time and sends alerts if it hasn't happened. TalkTech VeriCare. This system includes the smart turns, but also has motion sensors and temperature control, as well as a bed monitor. So that little gray square there on the side sits under the foot of a bed and can detect heart rate, breathing, movement, and a variety of other vital signs so that you're able to have peace of mind overnight for how your care recipient is doing or how the older adult in your house is doing. Also allows you to know if they've gotten up and if they haven't gotten back in bed. And then the last one that can be chosen from is MetaSweevy Care Predict. It uses both wearable and non-wearable again. So the wearable would be kind of like a smartwatch. It doesn't have a screen on it, but it takes vitals. And if you press the button on top, you can talk to your care partner through it. Again, a lot of different ways that that can be used and a lot of different ways it can be customized. They also have context beacons. This detects the location of where someone is in their home and the type of room they're in. This gives a variety of information about the status of someone in their home. And again, for instance, if mom or dad haven't gone to the kitchen in a couple days, you know they might not be eating or have gone to the bathroom and haven't left. Another place where a notification might be important. And so who can participate in this study? We're actually looking for dyads. So pairs of people. We're calling them care dyads. The only eligibility criteria is an older adult, 65 years plus, who lives in the community, just not long-term care, and needs or receives home care or community care support. And the point there is needs or receives. So if someone feels like they need services and are on a wait list, they're very much eligible for this project. And then their caregiver. The caregiver does not need to live in BC and does not need to live in the same community or the same house, but can as well. So both options are there. And that's just anyone who is defined as a caregiver for that person. So that might be a spouse, a partner, a friend, an adult child, or any other individual that cares and supports for the older adult. And what are care dyads asked to do? So firstly, as a care dyad, we understand the care recipient may not be in a place where they're able to complete all of the data collection activities. So we don't actually require the care recipient to complete any of these data collection activities. However, we do ask that the care partner complete them. So the care recipient has that choice and they can do the data collection activities, but they don't have to. So we have at month 0 baseline survey. So this just asks around what are your needs? What are your day-to-day activities like? Where is your, unmet need? Where could a remote monitoring system help? Then you get to choose your remote monitoring system. So that's when you would have a phone call or a Zoom with Laura, and she would take you through each remote monitoring system available, and you get to choose what you like for your home for your needs. And then you would receive or have the remote monitoring system installed. And the companies and us are both available for help with that if it is one of the systems that you self-install. Then as the rest of the year goes by, month 3, 6, 9, and 12, we would have surveys and interviews. The surveys are about 15 minutes and they are on the phone with Laura as well, not too long. And then 2 interviews. So these are just conversations about your experiences with the remote monitoring system. After the remote monitoring system is installed, there is no need to change any of your daily activities. So care recipients, care partners can go on living as they do. They just have this extra piece of technology. So the care recipient doesn't have to do anything. Just be aware that there might be sensors in their house now. The caregiver, however, would have the dashboard on the phone and would have to be willing to be okay with receiving the alerts or the notifications that come through if something were to happen. The Pheton research team does not get any of the data going through the remote monitoring systems. We do not see that data. We do not have any access to that. We only collect data from the caregiver and, if choosing to do so, the care recipient through the interviews and the surveys. So you might have all received this poster at some point, but it can also be sent out after or posted. This is our recruitment poster. It has everything I talked about today. I want to thank you for listening. And I see that we have chat and maybe some questions. So if anyone has any questions or would like more information, I am free to answer now or even later. Thank you so much.
Okay, great. Thank you so much for that wonderful presentation. And I can definitely see the benefits of that sort of technology. On a personal note, we actually had a neighbor when we were living in our condo who had, I think, some sort of cognitive impairment, and at one point had left his stove on, and we had to like evacuate the building, and the firemen had to come and break down his door and that sort of thing. So something like that stove turn off mechanism would have been great for him. So I can definitely see the value of that and the other technologies.
Yeah. And I should say, for those of you who are near or located in the Prince George Northern region, we do have a living lab here at UNBC that you are welcome to come at any time and test out the technology and even borrow it if it's something that you're really wanting to have a look at and see. And another thing is, while I talked a lot about kind of techie technology today, H-Tech is a range of things. So anything from we have something called SteadyWear, and it's a glove for essential tremors that allows someone to actually use their hand without the tremors happening. so that they can stay more independent. We also have things like robotic seals that are for those in cognitive decline that are therapy dolls, and they are really neat, and you can come and test them out and see them.
All right, great. Thanks for sharing that additional information. So I do see there's a request in the chat to share your contact information. So maybe Laura, you could add in that. And then there was a question about whether the program or the study is available for all in BC, which has been answered, and the answer is yes. There
Yeah,
was a question about availability in the Yukon, which unfortunately is not available yet, but maybe in the future it could be expanded.
yeah.
Um, and then an additional question from Nancy, how many participants are you looking for? Can you be anywhere in northern BC, which I think we've already answered, you can be anywhere in BC. And the request for the contact information and poster link. So I think Laura can share that contact information, but maybe in terms of the sample size that you're looking for.
Yeah. So we are recruiting up to 150 care dyads, so 300 people across the province, and and it's rolling enrollment. So we are welcoming anyone and everyone who is interested in participating currently. And as it is a year, we are looking to extend for a second year. Oh, and I should say, sorry. Um, as I said, no cost to participants whatsoever. The end of the study at the 1 year, you do receive the care dyad receives a $200 honorarium, and they can keep the technology. Now, some of the technology does have subscription fees, which the $200 can go towards. Some of them don't have any subscription fees, and it is just the technology. So those people can continue to use it. And that's something that Laura, when she talks with the participants, will go through the ones that have subscription fees, the ones that don't. And if we do get extended past that year, the year data collection just starts over. Again, no cost that year, and they'd receive again $200 at the end of that year as well.
Yeah, thank you for sharing that. That's great to hear.
Yeah.
And I'll give another moment to see if anybody else has any other questions that they'd like to put in the chat. But I did have one question that I was thinking
Yeah.
of when I was listening, which is that I know sometimes people must have concerns like the older adults sometimes about their privacy.
Yeah.
And I guess what are the ways that we can help people understand how these technologies are safe and will protect their privacy in their home? And how can we address some of those concerns that people might have around, oh, I'm not sure if I want that sort of technology in my house?
Yeah. Yeah. Laura, that's a great question. And it is very common to hear from people, especially when you say the word camera. All of a sudden, it's like, oh, can someone see me? So, first of all, um, each of those companies are compliant with all those privacy confidentiality guidelines that are set up by the government to be able to be used in conjunction with smartphones and computer. So each of the websites do have very fulsome descriptions of their privacy and confidentiality clauses and how that works. So that's something that we always direct people to. But also, we try to explain how this is more of a safety peace of mind way of looking at technology, not something that is spying on you. One of those pieces is with this project, we don't see the data. So we explain, if you fall, we don't see that you fall. No one's seeing that you fall other than the care partner. As well, on top of that, explaining that if you were to fall, if you're laying there, which we all have heard that horrible story, someone laying there for, 9 hours, thinking about having a sensor that can detect that and get you help almost immediately rather than having something happen and not having that help. As we get older, I think a lot of us want to maintain our independence. And this is a way to actually maintain independence, not decrease it. So, explaining that having sensors, having these things help you stay in your home or wherever you want longer, rather than transitioning to somewhere where you do actually have people around you 24/7, for instance. And so, there's a lot of ways to support people to make those choices, as well as because we have numerous technologies. if someone doesn't like the idea, for instance, of wearable, we have things that are just those sensors that, sit on the doors. So it is that kind of invisible sensing rather than always having that like alert around your neck or on your wrist. So some people prefer that. And also looking at what they need it for. So if fall detection is the only thing, well, then we wouldn't put sensors on the door, for instance. Or if wandering is the only thing, well, maybe we don't need cameras for fall detection. So lots of different ways to customize and ensure people feel comfortable. And of course, we're always there to answer any questions about confidentiality, privacy, all of those pieces. Um, we do have a lot of participants in previous studies that we've looked at the technology and privacy pieces. Um, and one of the wonderful things that at least myself as a researcher have heard from some of our previous participants is that they feel privileged to be able to help the next generation or later generations of people that are aging with this research. So they're like, it might help me, it might benefit me, but being able to help with preventative care evidence is so wonderful because then the health authorities know we have these remote monitoring technologies. We can prevent people from going to the ER, from going to the hospital, from needing to transition to long-term care. And it's wonderful that people are willing to participate in these and then they can also tell others, right? They're like, I had it in my house and it was fine. I didn't have those issues. So it's a lot of different aspects, but I think mainly it's just reassuring that this is a safe technology. No one is spying on you. Alerts are the only things that come through. So your care partner can't just turn on the camera and watch you, for instance. So a lot of those things, answering the question specific to the person that is asking them as well is also obviously very helpful because everyone has different concerns.
Yeah, thank you very much for sharing those insights. I think it's always kind of a challenge to balance that safety and privacy, but I
Yes.
really appreciate those comments and the efforts to make the technology support privacy. And I
Yeah.
see we do have a question in the chat from Sherry saying that she works with a lot of seniors who are losing their
Hmm.
linguistic abilities even
Yep.
after living in Canada for years or immigrant seniors. And is this study available for non-English speaking seniors?
So, as I mentioned with the care dyad, because the older adult or the senior doesn't necessarily need to answer or do the data collection activities, they don't need to speak English. However, the care partner would need to be able to speak English in order to complete the surveys and interviews. The consent, for instance, we do consent with both parties, so both the caregiver and the care recipient. If the care recipient is not able to give informed consent themselves, we do assent processes. So the caregiver, if they're the substitute decision maker, can give assent on the part of the care recipient. We do, however, go through the study and what they might expect with the care recipient. And we obviously would always make sure if they dissent, we would not have them participate, but we can have the caregiver go through that with them and allow them to agree or disagree to do it. So as long as the care recipient can speak and understand English, the senior does not have to.
Yeah, thank you very much for providing that additional
Yeah,
info.
Sherry. Yeah. I definitely, because we know that a lot of people when they're going through cognitive decline do revert to language they spoke when they were younger. So that is a really great point. Yeah. Yes, we can definitely, Laura can send that poster. Yeah.
Hmm. Yeah, we'll send after the webinar, we'll send out a copy of the recording probably within later today or tomorrow, and we'll also send the slides and the poster as well with the information and I think also the contact information as well. So if you are interested to connect with the researchers or seniors who might be interested, we'll have
Yeah.
those resources and we would of course welcome that.
Yeah. Wonderful.
All right, great. Well, does anybody else have any more questions? I see there's some comments in the chat just kind of saying that this seems to be an interesting project and people are interested. So I'm glad to see that there's so much interest because I can see how I think valuable this can potentially be, especially for older people and for their caregivers to give them that peace of mind about the well-being
Yes.
of the person that they love.
Yeah, definitely. We actually also have a project right now that we're doing with only one of the technologies, the Alton View Centenaire, with a continuing care community in Prince Edward Island. So we work across Canada, and that one's being installed in both community living as well as something akin to long-term care. And we're looking specifically at fall detection and prevention there. So that one's really exciting as well. And nicely links into this study. Hopefully, again, getting a lot of wonderful evidence to show that using upstream preventative measures can really help older adults to age in place and remain where they want. Yeah.
Yeah, that's wonderful to hear the scope of the work that you're doing. And
Yeah.
maybe if people don't have any other questions, I can just end with one last question that I'd be
Yeah.
interested to know is I'm sure people are interested to know after the data has been collected and the study's completed, how can they learn about the findings?
So the findings will be posted on our website. So the CTAN website that Laura posted a little bit earlier will also be contacting, well, we work with the ministry, so we'll be working with the ministry to have a report to show what this study showed. If you are a participant, you are able to sign up to get an infographic and a plain language summary. And again, that'll be posted on our website as well. So you can look out for that in the future, a little bit more than a year at least from now. However, we will have interim reports that will be posted as well.
Right, excellent. And I do see there was one more question in the Q&A box, but I think
Oh,
Laura is typing an answer to, but Nancy had just been asking to confirm, can they be a part of the study or try on their own? So I'm wondering, I'm not 100% sure what she means, but I'm wondering if the question is about can the seniors themselves sign up for the study?
yes. So it has to be a care dyad because we do need someone to be monitoring the remote monitoring system. So someone that is designated to get the alerts and to get any emergency notifications. However, if a senior wants to sign up both themselves and their care partner, totally fine. Either or can contact us, and either or has contacted us to learn more about the study and participate. But yes, we do need that second person because, as I said, we're not the ones accessing the data, and we want to make sure, obviously, there is someone on the other side to receive those alerts should something occur. Yeah. Oh yes. Oh, sorry, Nancy. Yes, of course. In PG at UNBC, our lab, anyone can come. Anyone can come see the technology and try it out for sure.
All right, great. Well, I think hopefully we've answered all the questions. If anybody does have a last minute question, feel free to put it in, or you can, of course, follow up with us afterwards. As we mentioned, we'll send out the recording, the slides, and the poster and the information about how you can get involved in the study. And so, oh, there's one more comment from the Office of the Seniors Advocate, and they just said they're interested to learn more and we can send them the information. So that's great.
Yeah, definitely. That's wonderful, Janice. I can definitely, if you'd like to email that contact email address there, we can definitely share with you more about the survey and interview questions for sure. They're not invasive. It's mainly about, you've had this technology in your home. Have you had any issues? What are the benefits? What are the barriers? Those kind of things. So it's very much looking directly at how they can help, but also what are the barriers and how might they hinder being in someone's home? Because we've all had that technology where you get it and you're excited, and then you can't figure out how it works, or it breaks down, or it doesn't work with your system. That's what we want to know as well. We want to make sure that these can be tailored and help people in British Columbia, of course, also across Canada.
Right, great. Well, thank you so much, everyone, for joining us today. I hope you found this a very informative session. I feel like I've learned a lot because I didn't know too much about remote monitoring systems myself. And so I just like to thank our wonderful presenter Emma, and you did a great job. And I think
Thank you.
we're all really looking forward to learning more about the study when the results are out, and hopefully some of our attendees are going to share this with the seniors, or they themselves might be seniors or caregivers and be interested in participating. So thank you very much for the presentation.
Thanks so much, Laura, for having us. We really appreciate it. And thank you everyone for coming. I know sometimes we're all busy, especially it's October, right? We're almost done October. So we really appreciate everyone taking the time.
All right. Well, with that, I think we'll say goodbye to everyone and thank you for coming. Take care, everyone.